Hello class. Today we're going to be going over data sets and information management. And this is in relation to practicing licensed nurses. So first, we'll start off with data sets. What are data sets? Data sets are a collection of various sets of information. Different types of data sets. Some examples of these include medical data, measurements, financial and statistical data, demographics of patient populations. These are very commonly used to assess community patient population needs for community health nurses or community health organizations. Insurance data, and these are just to name a few. There are many, many more healthcare data sets out there that are available for review. Some of the organization data sets that exist right now are outcomes and assessment information sets, minimum data sets for long-term care, nursing minimum data sets, and healthcare cost and utilization projects. I'm just going to go in a little more detail over OASIS, outcomes and assessment information sets. So this particular organizational set is designed to facilitate systematic measurements of home health care outcomes for patients. This measures the quality of the home health services provided by interdisciplinary team members and or nursing staff. And the quality care and data sets that are collected or analyzed are typically play a huge indicator and role in reimbursement for hospitals or home health service companies, either through independent organizations, insurances, to get those reimbursements back. Next, we're going to go over information management. What is health information management? Health information management, or HIM, is the practice of acquiring, analyzing, protecting medical information, patient information, and these data sets and data information collected through research. Now, let's put all of this information we just learned about the basics of data sets and information management and put it into the practicing licensed nurse. So we're going to look at HIM in nursing practice. Health information management is a vital everyday task registered nurses need to know and how to navigate, manage to provide the highest level of care. HIM in nursing practice is essential for informed, safe, and quality health care. So in relation to nursing practice, we're now going to look at data sets and electronic medical records. So then one of the most important and vital aspects of information management is the electronic medical record. This is an innovative management tool that combines multiple levels of different informational management access. So the number one and usually the most important and vital to a nurse is going to be documentation. Documentation in an EMR provides accurate patient and interdisciplinary collaboration possibility. Through being able to share notes, physicians are able to go in and see everything that the nurse has done, vital signs, full body assessments before they even go see the patient. So this actually makes for a more productive visit with the physician. And also not only that, but with a electronic medical record and documentation is through every interdisciplinary team can put a note or assessment inside of that. So every interdisciplinary team member can see every different aspect of this patient's care. By doing this, the patient gets taken care of as a whole, and care does not become divided. Respiratory care, does not come divided from the general medicine care. They all work together. They all see the progress of the patient. This ends up with more positive patient outcomes by having the patient addressed as a whole. Not only that, but this also improves continuity of care as long as collaboration and communication between all healthcare and patient team members. Then you have increased efficiency due to having all of that information extremely accessible to all participants of the healthcare team, as well as it is quickly accessible, which really makes a huge difference when there is a critical patient situation going on. The electronic medical record is also used for audits to improve for quality improvement. This also provides patient portals. The new thing is patient portals. A lot of new physicians' offices are creating these, and this gives the patient access to their own electronic medical record. A lot of patients oftentimes don't even know, especially if they're older, a lot of the health information. This keeps it in one spot. This keeps the patient informed. The good thing about patient portals is also it reminds them if they need a wellness visit or have a follow-up, they can contact and do questions for the physician through the patient portal as well. Immunizations, especially for pediatrics, it will inform you if you are up to date or out of date for immunizations or vaccinations. So that is extremely helpful in keeping the patient involved in their own care. Electronic medical record also allows for security monitoring and nursing security. So in security monitoring, there is, patient information is kept secured. Only people who are on that patient's care team should be accessing the patient's chart. They are able to see who has accessed that patient's chart. So a random stranger, family member's neighbor, no vital information or any of that patient information gets out where it doesn't belong. As well as security for the nursing. So nursing staff document every single thing they do in electronic medical record. Faculty members and staff and managers always say, if you do it, you document it. If you don't do it, you do not document it. This plays a huge role in malpractice suits, legal audits, and if it was ever to be case to be taken to court, your name is on that chart, and typically that doesn't even happen for years. If a case goes to court, it won't be reviewed for a couple of years. So it's extremely important that the nurse puts everything in that documentation as done, and that information is secured in case it is needed in the future. Lastly, electronic medical records and information management is fantastic for taking those data sets and that research that has been analyzed and using it for best practice advisories and clinical support. So this allows the informatics teams to go in and they can put alerts on patients' charts. So it takes all the information and documentation that nurses have previously put in on previous days and will send you alerts if the computer system notices either there's a SIRS alert or it's best practice to double check the packaging on a med or anything like that. And that also clinically supports the nurses as well. Evidence-based practice. Evidence-based practice research is the leading movement in improving quality of care, patient safety, and innovative best practices for medical care. Evidence-based practice integrates best research with clinical expertise and patient optimal care. Pretty much the basis of this is data sets. Research is done, data is collected and analyzed. A lot of that research turns into data sets, best practice advisories, and competencies for improved up-to-date practice in nursing, medical practice, anything like that. So information management is key in evidence-based practice and supporting the current role of nurses. Thank you.